DC politicians want to enact harmful credit card mandates that could take away your cashback and rewards points. Perks that stretch your budget and make life a little easier. Losing these benefits means less money for your family's everyday essentials like gas and groceries. The perks you rely on could disappear, leaving you with higher costs and fewer options. Tell Congress to guard your card and oppose the Durbin-Marshall credit card mandates.
Paid for by Electronic Payments Coalition.
Mr. Carney comes home to rescue a flailing cabinet minister. This is Now You Know. I'm Rob Snow.
The answers you need
from the people in the know.
This is Now You Know with Rob Snow on News Radio.
Prime Minister Carney is on his way back to Ottawa now after his trip to New York, where he's been attending the General Assembly of the United Nations. When he gets back to the nation's capital, he's expected to make an appearance today in question period. For the third day in a row, the Liberals will likely face questions about the future of the Public Safety Minister, Gary Anandasangari, who was caught on tape admitting the Liberals' gun buyback program is misguided, won't do much to help with gun crime, and that the government is only moving ahead with it because of votes in Quebec. But if the Prime Minister is planning to find another job for Anandasangari, he didn't let it be known yesterday. He defended his minister and the gun buyback program.
But these are guns that are assault rifles, AR-15s and variants, thousands of variants, and that decisions have been taken by Parliament in previous parliaments to ban them. So we have a mechanic in place in order for people to return them, consistent with decisions of Parliament, sovereign Parliament, consistent with an election platform on which we ran and on which we were elected, and this is fulfilling that. And so the minister is doing important work.
You still have confidence in it?
I have confidence in the minister. He's doing important work. He's got a lot of important work this session of Parliament, including legislation on borders and others.
Anandasangari didn't shy away from the news media yesterday, despite the controversy that surrounds him, and despite what he was heard saying on a secret tape.
You don't seem to have confidence in this program. Why not? And is it appropriate to stay on as Public Safety Minister?
I have absolute confidence in this program. As you can tell, I have brought forward. I'm making this announcement today in collaboration with my colleagues as well as Cape Breton Police.
If you could go back. You said you're doing it because the Prime Minister...
Saying something that I will do differently is not saying that I don't have confidence in the program. What I suggested was, in order to do it differently, there's a lot of frustration amongst Canadians, amongst those who've been impacted, that this has taken far too long.
On a secret recording, Anandasangari was heard telling one of his tenants that if he got into trouble for not complying with the gun buyback program, he would bail him out of jail. And when the tenant suggested he wouldn't recover all the costs he paid for his firearms, Anandasangari said he would give him money, which would seem to raise ethical questions about the minister, although he doesn't see it that way.
Canada is a rule of law. Why did you offer to pay someone the difference in compensation and bail them out of jail? You're a minister. Why'd you say that?
Let's maybe put this in context. This was a private conversation with an individual that I've known for many years. I said these two issues frankly, in bad humor, that is being misinterpreted. It is very clear that there was a private conversation. It is with someone. It is an acquaintance.
Do we believe you
well,
now, or should we believe what you said on the phone?
Well, first of all, it's not the phone. It was in the context of a private conversation in person. What is important is that if you look at it in context, that was not a serious attempt. It was a bad attempt at humor on my part. It was in no way to suggest that they will either I will bail them out or otherwise. That is not.
Is it a subject you should do humor about? Is it a subject you should do humor about?
Let's look at the context of it. It was a 20-minute conversation, and as part of the conversation in a private setting, it was a range of issues that we discussed.
Now, nothing gets the sharks of the House of Commons circling like the scent of blood in the water. In this case, the scent of a wounded cabinet minister. This is the leader of the opposition, Pierre Poilievre.
Well, I have to admit, Mr. Speaker, in all my years here, I've not seen this before. On Monday, a minister says that his program won't work. On Tuesday, he says he's going ahead with the program, a program that will take $750 million away from frontline border and police services to go after Grandpa Joe's hunting rifle, a waste of money that police say they won't implement and that the minister was caught on recording saying they will never implement. He even promised to bail his tenant out of jail if he breaks the law. When will the Prime Minister fire this minister?
That's been a very familiar refrain this week from the opposition Conservatives that Gary Anand Sangari needs to be fired.
He's actively trying to sell a program that he admits will waste $750 million and not improve public safety. Why won't the Prime Minister just fire this minister?
The minister's job is to keep Canadians safe, and he's saying himself that this $750 million program won't do that. Will the Prime Minister fire his minister?
He is mired in conflict of interest concerns. So would the Prime Minister finally do the right thing and fire this incompetent minister?
Everything in this file is a mess. So why doesn't the Prime Minister fire his public safety minister?
The minister had one job, and it's to keep Canadians safe. He's failed it. Will the Prime Minister fire his public safety minister?
His incompetence puts Canadian lives at risk. When will the Prime Minister fire him?
The budget for this gun buyback program is said to be fixed at $742 million. It will start with a small pilot program on Cape Breton Island. The federal government will pay the Cape Breton Police Service $103,000 for the administration of that pilot program. I'm Rob Snow. This is Now You Know. This is News Radio.
You have questions.
Now You Know with Rob Snow has the answers.
On News Radio.
Effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good.
That's the advice from the Trump administration in the United States, telling pregnant women to avoid taking Tylenol, claiming it has links to autism. But is it true? Dr. Deepa Singal is the scientific director of the Autism Alliance Canada. Thanks for joining us.
Thanks for having me.
What is the link between Tylenol and autism?
Thanks, Rob, for having me. There is no quality scientific data to support the claim that Tylenol causes autism, or that prenatal Tylenol use causes autism in children. No clinical body globally, Canadian, even in America, is even remotely changing any medical recommendations based on this announcement.
Where does this claim come from?
Yeah, that's a great question. So when scientists are pondering where these claims are coming from, or when these reports are coming from, there's a few observational studies out there that are showing really small sort of increased risks or associations. But what is really, really important for listeners and for Canadians to understand is that these studies are observational studies. So they look for correlation and they can't prove causation. And when you look at the most rigorous, most highest quality study that is observational, that came out of Sweden, was published last year, that uses this rigorous sibling design to control for genetic factors, family factors that are shared, it's showing that there is no association or correlation even. And so the claims that the Trump administration is making are really based on inconsistent and weak science.
What is the recommended advice to pregnant women who may use Tylenol for pain relief?
Tylenol is an incredibly important treatment in the reduction of fever and pain relief. And the recommendation to not use it could have incredibly dangerous consequences on both mom and baby. And so, yesterday, I believe there was a statement issued by multiple medical associations across Canada that, again, reconfirms what I'm saying right now, that there is no change in medical guidance and that Tylenol is safe to use during pregnancy.
Okay. I want us together and with our listeners to listen to something else that the president said during this news event earlier this week. Let's roll the tape here, Curtis, please, on Donald Trump.
They are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that.
Okay. What do you think about that? About what he's saying there?
Mm-hmm. Yeah, I think that listening to sort of this rhetoric is really dangerous and harmful for women who, as a mother, I can speak personally, have immense guilt over various plethora of things. Fathers can probably attest to this too. And adding this now new element that is based on absolutely no, medical guidance, any consistent scientific evidence, is really causing a lot of fear in pregnant women right now, stoking fear that is not based on science. This whole tough it out narrative, is really, really dehumanizing to women who are dealing with complex pregnancies, dealing with complex lives, and to be honest, Rob, it's noise, right? So rather than debating these it's noise, and right now, the autistic community is hurting, right? Because the way that the U.S. administration is framing autism as something to be feared, as a burden, as something that's tearing families apart, is taking away their dignity. And so to every autistic person out there who's listening, to parents, to siblings, to families who are advocating for their loved ones, right? The powerful self-advocates who've been so brave over decades to try to combat this kind of stigma, like your dignity and your voices matter so much more than this political noise or this inconsistent science that is now being debated.
Okay. Dr. Singal, do you have a few more minutes? I'd like to ask you a few more questions if you could just stay on the line. If you have a few more minutes. Sure. Thank you very kindly. We'll be right back. Dr. Deepa Singal is Scientific Director, Autism Alliance Canada. I'm Rob Snow. This is News Radio.
No question goes unasked or unanswered.
Now You Know with Rob Snow returns on News Radio.
Dr. Deepa Singal, Scientific Director at Autism Alliance of Canada, is with us here on News Radio today. I must ask you about something else that President Trump said. Now it's Tylenol, claims about Tylenol being linked to autism. For years and years, It was vaccines, of course. Trying to make claims that vaccines cause autism. Yeah. Let's listen to what the American president said again. Let's listen here.
And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies.
Okay, that's good. He says, is that a correct statement, by the way? If he was asking that to you, is that a correct statement, by the way, Dr. Singal? What would you say?
I'm going to venture out and say that that's absolutely not a correct statement. I don't have the data on the prevalence of autism in the Amish community, but I'm pretty sure that there are Amish people out there who are autistic.
Okay. Here's what I want to ask you as well. What is known about what causes autism?
Yes. So So at this point, the totality of the scientific evidence shows that, autism is a multifactorial condition. There's multiple factors that cause autism. There's no single cause. And framing autism in terms of an epidemic or a preventable disease really undermines that scientific integrity and disrespects the life experiences of autistic people.
Okay, it's a spectrum, right? We talk about the spectrum. Yeah. They're relatively, I would say mild to severe. There are different degrees of autism. Fair enough, doctor? I don't want to.
Yeah. So the language that, the autism community prefers is there's folks out there that have higher support needs. There's folks out there have lower support needs. There's autistic people that have more severe language impairments.
The reason I ask is I was wondering how likely is it, could there be different causes depending on where people are on the spectrum?
You know what, that absolutely, there could be, absolutely, but isolating that, science has not been able to do that right now.
Okay.
Right? So we know that the science knows that autism arises from complex interactions. It's genetic, right? There's biologic factors. That's what the body of science tells us.
Okay. Now, just to circle back and kind of tie a bow on this, you do not expect in any way the scientific community in Canada to make any changes on the advice to pregnant women who may feel the need to use Tylenol because of any potential links to autism.
Absolutely not. The medical community, the scientific community in Canada has been very clear. As I just said, multiple medical associations and bodies have spoken up, issued a joint statement yesterday saying that there is no change in medical care. And Tylenol does not cause autism. And it's incredibly important for pregnant women to talk to their physicians and discuss any medication use during pregnancy. Just reiterating, Tylenol is a very important treatment for fever, and the recommendation to not use it could have incredibly dangerous consequences on both the mom and the developing child.
Thank you, doctor. Very generous with your time today. Thank you so much.
Thank you so much. My pleasure.
Scientific Director, Autism Alliance Canada, Dr. Deepa Singal. I'm Rob Snow. Jump right back into federal politics right after the latest breaking news. You're on Now You Know. This is News Radio.
Critical thinking is not dead.
Now You Know with Rob Snow.
Returns on News Radio.
Well, it's time for our Wednesday Newsday political panel. Jordan Paquet is Vice President, Bluesky Strategy Group. Welcome back, Jordan. Good to hear from you.
Thanks so much, Rob. How you doing?
Just great. Chris Day is with us, so that makes the day all the better. Senior Vice President at Hill and Knowlton. How are you, Chris Day?
You were too kind, sir. Lovely to be back. Thanks.
Yeah, great to hear from you. It has been almost 5 months since the last election. There's still no deal with Trump. The economy is clearly weakening. The budget deficit is going to be off the charts when we finally see the budget. And quite frankly, some cabinet ministers don't seem to be up to the job. Chris Day, what can Prime Minister Mark Carney, 5 months into the job, claim as a win?
So I'm going to be charitable, and I'm going to say that he has brought a seriousness and rigor back to the federal government that has not been there for certainly the last couple of years, but perhaps the last decade, to be less charitable. I've heard it referred to as we've traded in, fun sneakers for Oxford wingtips in the Prime Minister's office. And I think that is only to all of our benefits, frankly. Now, what has not yet translated from that and what is not yet concretized yet is this bias for action, speed, build, baby, build. We haven't seen that yet translate into concrete actions, shovels in the ground, economic growth and growing the economic pie through, strategic investments. All the right things are being said, but, these are big issues and they do take some time, to be fair. But there's not a lot of tangible results given in the last 6 months.
Okay. Jordan, what would you say? What's a win for Mark Carney 5 months into the job?
Yeah, so I agree with Chris's point just around the style. I think everything from how he responds to questions in Parliament, perhaps a little more. I mean, if you watched his press conference yesterday, he at least seems to think through answers a little bit more than his predecessor, and I think has been able to recruit at least a few good people into government and into some of the agencies. But at the end of the day, what he had said previously is judge me on the price at the grocery store if they come down. And I think so to the average Canadian, if they're looking at this, they've seen things haven't gotten less expensive. In many cases, they've gotten more expensive. So I think it's one thing to command the attention of the national media, the corporate world, and all those things, which I think he's been doing a very good job at and potentially attracting some new investment into Canada. But at the end of the day, is that really trickling down to the average Canadian who's wondering about the prices of how are they going to afford their home, how are they going to afford things at the grocery store? So I think that's going to be his challenge going forward.
I must ask you, I mean, the big announcement coming out of the trip to New York and the speech to the United Nations is the recognition of a Palestinian state. Chris Day, you're the one with the foreign affairs chops on this panel. What do you think of that one?
This might, in fact, be the government's biggest misstep so far. I say that as perhaps the understatement of my week. The idea that you set preconditions for recognition and then don't even live up to those and go along to get along with a number of very troubled governments in Europe and elsewhere. So just to completely change Canadian foreign policy that has existed under successive governments of various political stripes for literally decades, without so much as the courtesy of a mention in Parliament, any sort of discussion whatsoever with opposition leaders and others, I think is a complete abdication of responsibility when it comes to diplomacy. I think it also, frankly, sticks a finger right in the eye of our, the only democracy in the Middle East, our closest ally in the Middle East, and our closest ally militarily to the south. Because
could I just ask you one more thing about this, Chris, just before we get to Jordan here? The timing of this on the eve of Rosh Hashanah for Jewish Canadians, the Jewish New Year, I find distasteful. That's my own opinion.
I wish they paid attention to, things like what's on the calendar. I don't even think that was a consideration here. It's just that we were all at UNGA having this discussion, and we'll do it there. I don't even know that anyone clued into the fact that it was Rosh Hashanah, which is even more shameful, frankly. But regardless of when the timing, it's insulting, yes, but regardless of when this timing happened, given the reality on the ground, the idea that you would go against our closest ally in the Middle East and create or at least give tacit acknowledgement or recognize formally what is ultimately at this point an idea that is only going to lead to a failed terrorist state on its borders is completely beyond the pale. And don't think for a second that that folks in Washington and in and around the U.S. president are not already saying this is another knock against Canada at a time when we can least afford missteps in that relationship.
Jordan, what do you think about the news from the UN on that?
Yeah, I mean, this is clearly something that he did, I think, for a domestic political audience, as opposed to anything on some type of principled foreign policy, like he was trying to say yesterday. Clearly, there was fault lines in the caucus. I think much more of them were on the side of Palestinian recognition, and had been right since the start. Even when Israel was attacked, it was hard to get someone to get out and really criticize it. So I think this was more a matter of trying to tamp down some of the issues in his own caucus, and perhaps in some of the areas of liberal support was. Which is never a good way to make foreign policy, but unfortunately, that's what tends to happen these days.
Okay, be right back. Wednesday, Newsday, political panel. I'm Rob Snow. This is News Radio.
Now you know with Rob Snow continues on News Radio.
Wednesday, Newsday, political panel from Bluesky. Jordan Paquet is here, from Hill and Knowlton, Chris Day. Gary Anandasangri is the public safety minister, caught on tape admitting the Liberals' gun buyback program won't work, and that the government's only moving ahead with it because of votes in Quebec. Now, to his credit, he did scrum with the press gallery yesterday after this announcement about the compensation side of the gun buyback program, and then he faced, he stood there and took it, took it repeatedly during the question period. But let's listen to a little bit of this from this event yesterday featuring Gary Anandasangri in the press gallery. Roll the tape, Curtis.
You don't seem to have confidence in this program. Why not? And is it appropriate to stay on as public safety minister?
I have absolute confidence in this program. As you can tell, I have brought forward. I'm making this announcement today in collaboration with my colleagues as well as Cape Breton Police.
If you could go back. You said you're doing it because the Prime Minister...
Saying something that I will do differently is not saying that I don't have confidence in the program. What I suggested was, in order to do it differently, there's a lot of frustration amongst Canadians, amongst those who've been impacted, that this has taken far too long.
Okay. Gary Anandasangri. Now, the Prime Minister did defend him yesterday, doing great work, doing important work, but are his days numbered in the Mark Carney cabinet? Jordan Paquet, what do you think?
Yes, I look, I don't think he's going to be done from cabinet tomorrow. I think this is going to be more of an evolution. There's been a few instances surrounding this minister, a few different reports out there about different conflicts of interest. This kind of being the latest one. He's really stepped into it now as part of this communications mess, and to a government that apparently and a prime minister that's apparently little tolerance for these types of mistakes. So yeah, I would see this being more of an evolution towards a broader cabinet shuffle. I mean, you already have Freeland left. There's some others that are rumored to be going. So I would think when it gets towards the time, perhaps at the end of this session, when the Prime Minister does decide to potentially, as it's reported, recruit some more people in, Mr. Anandasangri could be one of the ones to move along and spend more time with his family.
That seems to be a consensus among the people who have been on our Newsday panels this week. Let's just make it to the budget, and we'll think about the team we've assembled here after that. And maybe there's a wider shuffle coming. Maybe Mr. Anandasangri is part of it. What do you think, Chris?
Well, there's definitely a wider shuffle coming. There are a number of folks, as I understand it, that are not seen as delivering, are not seen as being able to deliver, and are not happy in their current roles. And I'd heard much before this latest controversy that this minister was indeed one of those folks that was not terribly happy with his role and was experiencing some challenges in it. And this is, I think a coffin nail for him in this capacity. I don't think that necessarily means he leaves cabinet, but I don't think he'll be in public safety much longer. To Jordan's point, though, there is a broader there's a broader move afoot. I think they're seeing how certain cabinet ministers are bringing themselves and their files to the table, and the prime minister, as the prime ministers want to do and is entirely within his prerogative to do, is making decisions as to whether or not those people will still be invited to the table for much longer.
Okay, if you're making a list, is Lena Diab, the immigration minister, on that list of people who are on thin ice? What? I don't know. Lena Diab was absent on the immigration file all summer when it was a very hot political topic, has now just sort of started talking about it only when questioned about it in the House of Commons, and seems to be just like a deer caught in the headlights. Can't imagine what all the fuss is about. You needed an effective communicator in a role like that. I don't think she's it, quite frankly. What do you think, Jordan?
Yeah, I was just going to say that. Maybe behind the scenes and working through policy files, she's incredibly smart at this. I have no idea. I don't know her. I know she had, I think, some of these files provincially, but obviously this is on a much higher scale. And you're right, Rob. This is something that is top of mind for a lot of Canadians right now. But the fact is that yes, she's not good on her feet in the House of Commons. She's not good at explaining the government's position, and there is. There is some other talent, I think, from whether they need to fill a seat in Atlantic Canada or anywhere else. But I think there's other people that could step up to do this, or potentially leaves room open for Mr. Carney to bring in some of his own people to put his own face on this quote unquote new government.
Okay, we will stop here. Be right back. We'll talk about a few more things on the Conservative side of the benches, featuring Pierre Poilievre. His communications strategy seems to have been adjusted, and he will face a leadership review in January. We'll talk about that when we come back. This is News Radio.
Now you know with Rob Snow continues on News Radio.
Here with Jordan Paquet and Chris Day, our politicos today on our panel. Let's talk about Pierre Poilievre's communication strategy. Loyalists used to say he doesn't need to do mainstream media interviews. He doesn't need to be interviewed by the Sunday political talk shows. He can go around all of these people. He doesn't need the press gallery. He'll use social media. That's how he'll get his message out. Now we see Poilievre is doing interviews with the traditional television news networks. What's going on here, Chris Day?
He placed second.
Okay.
That's the long and the short of it. He placed second, and he lost some ground with senior citizens in this country, which are not insubstantial and quite active voting contingent. And they're the people that are still watching conventional television. So this is a definite change, a definite pivot to sort of get to those folks. I nearly fell off my chair when I heard him on a CBC radio program last weekend.
Yeah.
And he didn't mention closing the CBC once. So that is a definite change in message. I've noticed a change in tone, change in content. I don't think it's a bad thing. I think it shows that he's matured. It shows he's learned.
Jordan, what do you think?
Yeah, no, I agree with a lot of what Chris said. I think this is, it might not be a wholesale kind of change. I think it's sort of evolution, adding some more areas in which they can focus on. I mean, he's done really well amongst the social media, the right-leaning podcasts, all of those things in the country. And then to Chris's point, what he was starting to lose out on, and what the election showed, is that amongst the 55-plus crowd who are still watching the supper time political programs, who are still listening to the radio in the morning and drive to work, or it's there in the background. So I think it's very smart for him to be on as many of these platforms as possible and taking that message directly through to people. So I think this is more of just kind of another, like an evolution in the communication strategy. And losing some of that really combative tone against the press gallery, it tends to help a bit.
Give me a number for this January leadership review. What's a winning number for Poilievre? What's a winning number? What does he have to get to put any doubt to rest? Chris?
I would think somewhere in the 65 to 70% range.
That's it? Really? 65 to 70%?
I think he'll get more than that, but I think that would be the minimum.
That'd be the minimum. Jordan, what do you think?
Yeah, I think he's going to be over. I think the goal would be to get much higher than that. It's certainly over 70%. One thing about Pierre's team is that they're incredible organizers, and they have a ton of now. And they look at the number of people that signed up for the leadership race. They know how to organize in the party. They'll get the delegates. They'll get the support of the delegates. I would expect he'll be much north of 70%. But that's certainly a good enough number to stay on. For sure.
Premier Smith, when she had her leadership review, got 91% approval from the UCP. Could you see him getting something like that, Jordan?
It remains to be seen. I guess it depends how organized they are. I think that's a very high, lofty goal for sure. I remember back in 2005. Let's go back to comparing it to Stephen Harper's time. I think he got around 80% at that in Montreal. And that was after holding the Liberals to a minority government, and Paul Martin went on to win it next time. So let's see if history repeats itself.
Okay. There's a lot happening. Thanks for helping us understand it a little bit better. We'll speak soon, guys. Bye-bye.
Always a pleasure. Thanks.
Yeah. Jordan Paquet from Bluesky Strategy Group. From Hill and Knowlton, Chris Day. Talkback next. We're going to talk about healthcare today on Talkback. This is News Radio.
It's time to talk back.
On Now You Know with Rob Snow.
Call now.
And have your say.
1-833-668-2577.
Welcome to Talkback. It's 2 hours of debate and discussion on the big issues of the day. Today's topic is healthcare. Healthcare. Very simple question to get the conversation going today. What have been your experiences, good or bad, with the healthcare system? What have been your experiences, good or bad, with the healthcare system where you live? 1-833-668-2577. 1-833-668-2577. The reason we ask is because there have been several reports recently about the state of the healthcare system in this country. As usual, these reports are not flattering. A report from the Montreal Economic Institute about the situation in emergency rooms across the country came out a few days ago. It said 1.2 million people left the ER of Canada's hospitals without being treated. 1.2 million. That's 1 in every 13 visits. And it is a figure that has soared across the country in the last 5 years. Nationwide, an increase of 35% in the last 5 years. In some provinces, much higher than that. Up 94% in Newfoundland and Labrador. Up 87% in Manitoba. 54% in Nova Scotia. 31% in Ontario. An increase of more than 76% in Alberta. People go to the emergency room, but they leave before they ever get treated. Not good. As the report points out, and as medical experts have said, some people who leave the ER without ever being treated run the risk of their health condition getting worse, increasing the risk of complications and even death. 1.2 million people left the hospital ER without ever being seen by anyone, before ever being treated. In a report released just today, think tank secondstreet.org suggests more people are sitting on wait lists for medical care than were on wait lists at the end of the pandemic. This is a brand new report. I managed to get my hands on an early copy. It says that there are 3.7 million Canadians on healthcare wait lists across the country. These are Canadians who are waiting for surgeries, diagnostic scans, or to see a specialist. The report also notes there are gaps in the data because some provincial governments don't collect the data. The best guess from these researchers is that the true figure is probably closer to 5.8 million Canadians on a wait list for a medical procedure. That's 1 out of every 8 Canadians waiting and waiting for health care. In Alberta, it's more than 500,000 people on a healthcare wait list. And the number of people waiting for a medical scan has ballooned by almost 70,000. In Ontario, it's almost 1 million people. And the government doesn't have a clue how many people are waiting to see a specialist because the Ford government doesn't bother to keep track of that. In Nova Scotia, it's more than 132,000 people. That's 12% of Nova Scotia's population on a wait list for a healthcare procedure, waiting for surgery, waiting for a scan, waiting to see a specialist. A recent report from the healthcare technology company Philips looked at healthcare wait times in 16 countries. Canada had the longest wait times and ranked 16th on the list, an average wait time of 131 days. More than a quarter said their health had worsened because of delays in seeing a doctor, and 1 in 5 said their condition worsened to such an extent because of the long wait, they ended up being admitted to the hospital. And the report notes that more and more Canadians who can afford to do so are giving up on public health care, and they are instead seeking out private health care options, even if it means they have to pay out of pocket. The Canadian Medical Association says 6.5 million Canadians don't have a family doctor. Frequently, there are news stories about hospitals closing their emergency rooms because they're understaffed. 50,000 days worth of closures. A study by the federal government said the country is short 23,000 family doctors, 14,000 practical nurses, 2,700 nurse practitioners, 28,000 RNs, 2,000 occupational therapists, 2,600 physiotherapists, and 1,700 pharmacists. And it predicted that unless things change, they will only get worse, not better. Staffing shortages will grow. And these outcomes are despite the increasing government money spent on healthcare. Provincial governments, along with the federal government, spend almost $400 billion a year and growing on healthcare. Some of the studies, some of the data, but patients are not data points. It's real people who go to the hospital. It's real people who go to see their family doctor, if they're lucky to have one. We want to hear from you today. Is it really as bad as it sounds? What would you say? What have been your experiences, good or bad, with the healthcare system? Have you gone to the local ER only to give up and leave because the wait was too long? Are you waiting for a healthcare procedure? Are you on a wait list? Waiting for a scan, a specialist? Waiting for a surgery? Are you looking for a family doctor? What's that like? Have you ever considered paying for health care? 1-833-668-2577, 1-833-668-2577. If you've never called before, just mention that and we'll make your call a priority. And we'll talk about your experiences with the healthcare system. I'm Rob Snow. It's Now You Know and Talkback on News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
Healthcare. Let's talk about healthcare and your experiences, good or bad, with the healthcare system, where you live, wait times, ER visits, looking for a family doctor, paying for private healthcare. All of it is in the mix today. Up for discussion at 1-833-668-2577, starting in Halifax with James. Thanks for calling, James. You're on Talkback.
Hi, good day.
Hi, James.
Yeah, I'm calling with a good news story, and it's about myself. I'll keep it brief. I'm not denying that the primary care end of the thing, in other words, whether you walk into an ER or trying to get a family doctor, that initial contact can be problematic or hard to get access. But a few years ago, I walked into an emergency room off the street in Sydney, Nova Scotia. I won't give any more details about names and dates, but just not long ago, no, just a few years ago. And it was Easter Sunday, early afternoon, or mid-afternoon. All I knew was I had a terrible headache and I don't get headaches. So I went to the triage desk and told my little story, and they said, okay, hang on. Not long later, I was ushered in to see the doctor, and he asked a few questions. He did do a quick CT scan. That doesn't take long at all. And he said, your brain is bleeding out. It's called a ruptured brain aneurysm.
Oh my goodness.
So yeah, but I was a quote healthy 65-year-old. And he said, you're going on an airplane to Halifax and you're having emergency brain surgery this evening, Easter Sunday. Wow. I was put on a plane. I was put on an air ambulance, got to Halifax, got to the, tertiary care hospital here in Halifax. And the doctor came in from Easter dinner or whatever and did the surgery. And here I am. So
wow, amazing.
Sometimes.
So you went to did you go to the Cape Breton Regional Hospital then? Is that where you went?
Correct.
Okay. All right. Okay.
Yeah. And I can give you any more details you want, but I know you've got other callers. But all that to say, the triage nurse did a good job. The doctor, who was just a resident, he told me that because Easter Sunday, a lot of the other ones were at home with their families. And interestingly, I think this is actually relevant. He told me he was a recent immigrant from Nigeria. One of the solutions to our problems in healthcare, I believe, is immigrants, because we don't have enough nurses. We don't have enough X, Y, Z. You outlined the statistics. And yet some Canadians are saying, oh no, turn off the immigration tap. Well, there's immigrants and there's immigrants. If people are coming with skills that we need, I say, what's the problem?
Yeah, well, some of them might be here already, and it's just they're not properly credentialed, or it's such a bureaucratic nightmare to get credentialed. That's part of the problem. Thank you, James. Thank you. Cheryl in, speaking of which, Sydney, Nova Scotia. Hello, Cheryl.
Hi,
Cheryl.
Rob. How are you doing?
Very good. Thank you.
This is a very triggering question. The real story here for the worst cases, they're under an NDA, and they can't really say what happened, but it's really bad, and they're not allowed to talk about it if they've pursued legal avenues. But I can say that it's very bad, very scary. Please advocate for yourself. Don't take no for an answer. If you feel you're being pushed out of there, the wait times are atrocious, but by leaving, you could be choosing death. By staying, you're still fighting against death, fighting to be heard, fighting to be attended to. And if you do see a doctor and they do try to turn you away, please get, proper tests and demand and advocate for yourself. Or ask for an administrator if you're, not too sick to fight, or have someone there with you who can advocate on your behalf. That's about all I can say, because it's very limiting. And the truth is kind of difficult to get out there because of how the legal system goes with these cases, the worst ones.
Okay, but I've heard this before. If you have a loved one who's trying to navigate the healthcare system or is in a hospital, you have to advocate for that person. You really have to advocate.
100%. And I mean, if they're getting sicker and, sometimes they can't speak, they can't move, they're in pain, you need to have someone there with you, because that they can be turned out or pushed out in a wheelchair and be told that they have to leave. And if there's no one there to fight for them, it's a very scary situation. It's getting scarier by the minute, actually.
Getting scarier. Okay. Cheryl, thank you. Sydney, Nova Scotia. On Cape Breton Island, I'm Rob Snow, 1-833-668-2577. There you go. I said good or bad. We've heard the good. Not so good. Downright bad. Your experiences with the healthcare system. Today on Talkback on News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
We're talking about healthcare today. Gathering your experiences, good and bad, with the healthcare system where you live. Al in Calgary is up next. Hi, Al. Thanks for calling.
How are you doing, Rob? How are you doing today,
Very
Rob?
good, Al. Thank you.
Right.
What's your opinion?
So, a funny story. As I'm on hold waiting to speak to you, I get some private healthcare commercials on the radio. So, kind of ironic. So, just about MRIs, Rob. Just a personal story goes back to 2020. I was on a waiting list for better part of a year to get an MRI on my knee. I was able to get in to see the surgeon before my MRI was actually done. So when I saw the surgeon, he says, yeah, we got to get you an MRI right away. I was able to get into an MRI that I paid for out of pocket, $600, the very next day. I had surgery within that month.
Okay.
3 months later, I get a call from the exact same clinic that I had my MRI and paid for, saying, oh, hey, Al, we have your appointment ready. Can you come in next Tuesday or whatever it was for your MRI on your knee? In the meantime, I've already had surgery. So what's happening here is our Alberta government is paying private clinics to do our MRIs. Okay? I can get in tomorrow to get an MRI if I'm going to pay out of pocket.
Yeah.
But they only buy so many. But in the meantime, and this is where it really drives me crazy, in the meantime, every hospital in the city of Calgary has MRI machines being staffed 24/7 for emergency purposes. Now, if I'm in pain and I need my knee looked at, I have no problem taking an appointment at 2 o'clock in the morning within one of our hospitals where the machines are running and there's staff there. Right?
Okay.
So it's an absolute waste of our dollars to have these machines sitting there idle while we're paying for private clinics to be doing our MRIs.
Run them 24/7, 365, you're saying?
They are. They have to be. In a car accident, somebody comes in, whatever. They need to put them through
but maybe, but they're not being used to their full capacity, is what you're saying, right?
Not at all. And like I say, Rob, if I'm on a standby list that, hey, you might have to go to the hospital for 2 or 3 hours, but you're going to get in and it might be in the middle of the night, I'm okay with that. I'm in pain. I can't function properly. Why not take advantage of what we are already paying for rather than buying so many MRIs per day or week or whatever it is that the Alberta government buys?
Okay, thank you. Al in Calgary. Jason in Cambridge. Actually, Jason, you hang on. If you come on now, you only have 30 seconds. I want to give you more time than that. Wait times, ER visits. 1.2 million Canadians went to the ER. They never saw anybody. They went home. 1.2 million. Looking for a family doctor. 6.5 million Canadians without a family doctor. The increasing use of private healthcare because Canadians are becoming frustrated with the lack of access to Medicare. Let's talk about all of this today as we talk about healthcare and you gather your experiences, good or bad, with the healthcare system. The latest breaking news is coming up next. I'm Rob Snow. It's Talkback, and this is News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
What have been your experiences, good or bad, with the healthcare system where you live? Up first here now in Kitchener's. Tim is in Kitchener. Hi there, Tim. No, not Tim. Sorry. Cambridge. Jason. Sorry. Yeah, Jason. Let's go to Jason. Hi, Jason.
Good morning.
Yeah,
Good morning.
hi, Jason.
Yeah. Good morning. I can give a unique perspective on this. So I used to be a purchasing manager for one of the largest paramedic services in Southern Ontario, and I'll give you a graphic story to tell you as well. So I unfortunately cut the end of my finger off in Toronto, and I went to the hospital. So like the bone sticking out and things like that, and it was an hour to get triaged, like not even for them to say, okay, you cut your finger off, then you're going to wait the 10 hours. It was an hour to be seen. So luckily, knowing the paramedics, I'm an MBA, I'm not the paramedic. I went out to the waiting ambulance that's probably sitting there for 10 hours. So they bandaged me up. Then the people in front of me realized they triaged me. The crowd triaged me. So they let me go front, and I got seen. Some lady during that hour while I was there going through shock, she had destroyed her leg. Like, she broke her leg so bad. She was screaming the whole time. And by the time she'd come, the triage wait line was 2 hours. So she actually just left. God knows what. Hopefully the paramedics.
Oh my gosh.
I don't know. So, yeah, that's crazy. An hour to get triaged, right? So I have the solution, and it's not immigration, because there's far more people to come in to consume the service than our doctors and nurses, because they may not be qualified under our system. So the solution is, and I learned this when I worked for the paramedics, Finland would come over and they would say, hey, what are you guys doing? And then so I learned what they're doing. They've got one of the best medical systems in the world, because they have private and public. And it's one of the best in the world, because if you can't afford the private, you go to the public. And the public's great, because all the people that would have been on the wait line in the public that can afford it, they go to the private. So everybody gets better service. Like, I had a sinus infection. The wait time was 9 months. I went to Buffalo and I spent $100. It was a 2-day wait, because I couldn't wait 9 months to get antibiotics to do it. So we have sort of public-private. I know many people that have gone south for surgeries. But again, if you want more doctors in this country, let somebody start up a private clinic for something. And then all these people that think our system is so great, if you think our system is so great and these people want to charge for something that's free, well, then they'll go out of business. Why are you stopping them? Let them put their shingle up.
Right.
Because I'd go pay $100 to see an ENT and not wait 9 months. And there's lots of people I know that had the money. They went down south for the surgeries for the same reason. I don't have that kind of money, but there's a solution.
Okay, thank you for your call. That's you didn't lie when you said it was going to be graphic. Jason, Tim in Kitchener is next. Hi, Tim.
Hi, how are you?
Very good, Tim. Thank you.
I don't have a lot of faith in the healthcare system.
Okay.
In 1986, I got rear-ended going to work one day. And my car went up in flames. I was knocked out inside the car. The guy that hit me, he went up in flames, and he was knocked out. And a tow truck drivers were having breakfast. They saw it. They came running across the road with a hand jack, and a fire extinguisher, and they started putting the fire out. And one of them brought me to, and then got me out. And from that point on, in 83. From that point on, I had all kinds of trouble. I didn't know what it was. I was in the hospital at the time of the accident, and they let me out. I had to wear a neck brace for about 5 months, till I could move my neck. And then, as it kind of settled down, other things were appearing, and I had no idea what it was. And then about 5 years went by, and then it started getting bad again. And then I went to my doctor, and I had switched doctors because my doctor at the time of the accident retired, and I had to get a new doctor, and he took it over, and then he retired, and now I got another doctor. So anyway, but my doctor is very good. He knows what happened. I can't blame him, because he wasn't around when this all happened. But I went to the hospital one time. I woke up in the morning and I couldn't touch my nose. It's always on my left side. My left hand would touch my ear. I could touch anywhere, but I couldn't find that nose.
Wow.
And I thought I had a stroke. And they said, no, you didn't have a stroke. They gave me a CAT scan, and no. So I said, and I never thought to say anything about this accident in '83. So time went by. It came up unsolved. They had no explanation. And then a couple of more years went by, and it started getting bad again. And I went to St. Mary's Hospital, and the doctor said, I think you got hydrocephalus. And I said, what's that? He said, water on the brain. It's high impact. Oh, well, I was rear-ended. Well, he said, I'll bet you that's what it is. So I'm going to send you in a non-emergency ambulance down to London. And there's a team in surgery right now, and they're going to bring you in and put a shunt in, probably. I said, all right. So I went down in a non-emergency ambulance, and the guys down there said, well, just bring your CAT scan. So I took it with me, and he looked at it. No, I need more tests. We're going to let you go. And I was pretty bad. And I said, really? And he said, yep, we're going to let you go. You will get you back in about, a couple months or whatever it takes to get in. And I said to the guy that night, I said, what really pisses me off? He said, what's that? If I was Wayne Gretzky, I'd be here Monday. This was on a Friday.
Mm-hmm.
And he says, well, that's just the way it goes. So he thought about it over the weekend, and he had me down on Tuesday. They called me Monday and come Tuesday. And so I went down on Tuesday, and I said to the guy, I met him at the lobby in the hospital. And I said, he said, do you remember what you said to me? And I said, not really, but I apologize, but it was bad. But you said something about Wayne Gretzky Monday, and I said, how's Tim Tuesday? Pretty good? Well, yeah, I appreciate it. Well, I realize you're in trouble.
So what happened in the end, sir? Very, very quickly, what happened in the end?
In the end, I had to have brain surgery. 18 years later, it'd be 20 years later.
20 years later.
The guy originally had said it was hydrocephalus. It was hydrocephalus. I had water on the brain.
Wow.
And my
20
health
years.
Went right in the toilet. Well, I'm still fighting it. I've had the surgery, but it's going to take a long. Your brain remembers. If you start, I lost my walking went away. Right now, I can't.
Sir, we're just right out of time. But I wish you all the best in your recovery from that. A 20-year ordeal with the healthcare system, though, is quite something. We do have to go, however. I'm Rob Snow. This is Talkback. This is News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
We're talking about healthcare today. Shane in Brooks, Alberta. Hi, Shane.
Hi, Rob. I've phoned in a few times. I just want to say I appreciate how you conduct yourself on this show. Keep up the good work.
Thank you.
When it comes to the healthcare system in this country, speaking from experience, it saved my life twice for sure.
Okay.
It depends what's wrong with you. In a perfect world, the government would start building hospitals today and they'd never stop, and they'd have the staff to fill them up. But if you go into Emerge and you have something that's, a run-of-the-mill problem, let's say, and someone like me comes in with blood pressure so high, if I told you the numbers, you wouldn't believe me anyway. That happened to me. And so Emerge was full of people. I went in with blood pressure out of this world from some other stuff that wound up getting fixed. And I got admitted immediately because there's a chance you could die, right? So I really can't complain about how I was looked after in 2 or 3 different instances in my life where I wound up having surgery that without it, I would have died. Now, on one occasion, I shared a hospital room with a guy who had a badly broken leg, and he was waiting his turn, but I was ahead of him, and he was still there when I left. So if you asked him, you'd probably get a more of a negative review. So like I say, it depends what's wrong with you. It's just unfortunate in this country that, we've had government that could have built a major hospital in every city from coast to coast with the money that they've wasted, but that's a whole nother conversation. You know, I also know people that had lots of money to pay their own way and go to the States and have their knee fixed when they maybe couldn't get it done here or couldn't get it done here in the time frame that they wanted or whatever. And that's their good fortune. Not everybody has that kind of money laying around to go pay 50 grand for a surgery. But I really can't say anything bad as far as the healthcare system in this country saving your life when the chips are really down. But I guess I hear stories of people that have died in the emergency room too. I think it's going to happen regardless every once in a while. And some people think it's just brutal and they got nothing good to say about the healthcare system. But I don't necessarily agree with that. I'm not going to say it's perfect, but like I said, first off, it really depends what's wrong with you. And, you know, the people that are employed by this province to fix you up and look after you are doing the best that they can, I think.
Oh, yeah. And none of this, I want to be clear on this. I'm glad you brought this. None of this is a slight against people who are on the front lines of the healthcare system, doctors, nurses, and everyone else, right? They're only working in the system that they have to work with.
And if anything, they go the extra mile. I mean, they did for me, and I wouldn't be here if it wasn't for the surgeons that worked on me.
Very good. Glad to hear.
You know, but I mean, like I realize not everyone's going to agree with me. I understand some people have some real awful stories about their health and how it's all shaken out when they've had a major. But anyways, it would be nice if we could elect a government that prioritized what a lot of people like to complain about, which is, and healthcare seems to be one of the glaring things that they bring up when they're criticizing a government. And when you look at the money that's been squandered and wasted in this country for the last however many years,
it's understandable. It's understandable. Look, I've got to wrap up our conversation there. Thank you, Shane. I do want to fit in one more though, just before we stop. Let's go to Cambridge, Dallas in Cambridge. Hi, Dallas.
Yes, sir.
Yes, sir. Your experience is good or bad with the healthcare system?
Oh, I got to say overall, I mean, I'm not one of those run to the doctor for every little thing type of people, but throughout my late wife's problems and my couple of problems, I got to say I'm pretty satisfied. One thing I don't understand, though, I don't know if it's across Canada, but I know it happens in the province of Ontario. So if you walk in or call your doctor, if you happen to have a family doctor, and say, well, I got this going on, they say, well, okay, we can't get you into next week. Okay, well, all right, I'm in pain, so I'm going to go to a clinic, and that clinic will back charge my doctor. And then the doctor gives me crap for going to the clinic.
Yeah. There have been stories there have been stories, Dallas, of family practices dropping patients for doing that.
I was just going to say that. They will drop you like a hot potato if you've done it too many times. And that part of it, I really don't understand. I agree with Al 100%, one of your previous callers, as far as the misuse or the non-use of medical equipment sitting in our hospitals late at night doing nothing. I agree with that 100% too. And I agree with what Shane just said about the squandering of millions and millions and millions of dollars. Somebody really needs to get a handle on that kind of stuff.
All right, Dallas. Thank you. Thank you. You've made several good points. We're talking about healthcare today. Wait times, ER visits, family doctor searches, paying for healthcare. 1-833-668-2577. To have your say on Talkback on News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
We're asking about healthcare today. That's our topic. And your experiences, good or bad, with the healthcare system where you live. 4 lines available there for you. Love to hear from you today. Herman in Calgary. Hi, Herman.
Hi, how are you?
Very good, Herman. Thank you.
Hey, Rob. You had a caller two callers ago there so eloquently described what I wanted to say, so I won't make it long. I just wanted to say, just be a bit of a cheerleader for Canada, our health system. I think I personally think it's fantastic. Anytime in my family that we've needed it, like right away, we got the best care. Like just the best care. And just to finish it off with one more thing, I was on Facebook the other day because I'm an old guy, and there was a meme about our healthcare system. In the comments, there was just one American after the other saying the same thing. I'd be happy to wait 4 hours. I'd be happy to wait 8 hours. Be happy to wait 2 hours so I don't lose my house. I don't lose my health. So, just want to be a cheerleader.
Okay, yeah, fair enough. But what about 1.2 million people who go to the ER and never see anyone?
Again, I don't want to sound cold here, but if you're in the ER, like I out of those 1.2 million people, how many of those people got worse? How many of those people died? Like, for example, and I heard a quick comment from another people about immigrants going to the hospital. My parents were immigrants, and I won't lie, my mom, if we just had a sniffle, she had us in the waiting room for 8 hours. It was just the way she was. She came from a country that didn't have health care, so she took advantage of it. Right? But, and I don't want to sound like a jerk, but if you have a cold, maybe don't go to
the emergency room. Yeah, fair enough. But look, 1.2 million Canadians went to the ER. They left without ever being seen by anyone. 5.8 million people are on a healthcare wait list. 6.5 million people did not have a family doctor. I understand you want to do some cheerleading, but we also have to have a serious discussion about what's going on with this healthcare system. Would you agree?
Oh, for sure. Anything could be made better, without a doubt. I just like to look at, again, I'm a big cheerleader for Canada. I look at other countries and what they have compared to what we have, and I just think this is fantastic here. But yeah, no, I hear you. There's people that slip through the cracks all the time, and there are those horror stories, just like that gentleman with the brain injury that's been going on for 20 years.
We're talking about millions of people here. These are not cracks. These are chasms. All right. Thank you, though. I appreciate your opinion. I say good or bad. And you think it's, you're a cheerleader for Canada, fair enough. And you know what? Look, when pollsters or researchers ask Canadians, what does it mean to be Canadian? What defines the Canadian identity? Taking care of one another always comes up, and they cite universal publicly funded healthcare, always held up as one of the defining features of this country. And yet it is a system that is seriously under strain. That's it for hour number 1. Full hour still ahead. Your experience is good or bad with the healthcare system on Talkback on News Radio.
It's time to talk back.
On Now You Know with Rob Snow.
Call now
And have your say.
1-833-668-2577.
We've been asking for your experiences, good and bad, with the healthcare system. Have you gone to a local ER only to get up and leave because the wait was too long? Are you on a healthcare wait list, waiting for a healthcare procedure? What's that like? Waiting for a scanner to see a specialist, get a surgery done, looking for a family doctor. How's that going? Have you considered paying for healthcare? Signing up for one of these private clinics that seem to be popping up all over the place these days. Have you paid for private health care in the past? What was that like? 1-833-668-2577. Gail is up first in hour number 2. I'm Rob Snow. Gail is in Kitchener. Hello, Gail.
Hello.
Hi, Gail.
Hi. I'm calling because of both positive and concerning experiences. My most positive, ours derives from my family physician. If I have a problem, she fits me in that day every time. My only concern was the care for my mother when she had a stroke in another community, and I had to take her to the ER and wait an inordinate amount of time, and told to take her home and take her to her family doctor. the next day. I
Oh my
worried
gosh.
he'd have another stroke that very evening. But once she was with her family doctor, she had immediate, excellent care. So my suggestion for everyone is to make sure you get a family doctor.
Well, I would say it's easier said than done because we have 6.5 million Canadians who are out there and they're looking for family doctors. So it's a big problem. The government did its own study on this and said we need 23,000. Right now, we're 23,000 short.
Right, but there are lists of doctors accepting patients in every community. I don't think they're being tapped into. The people don't realize that there are some alternatives.
Okay. But you're so right because, if you don't have a family doctor, you're sort of without an advocate and you're sort of without a point person who kind of navigates everything for you, right?
Yes, definitely.
Yeah. Okay. Well, Gail, you've outlined some good and bad there. I thank you so much for being a caller on Talkback today. Let's go to Red Deer. Paul is in Red Deer today. Hi, Paul.
Hey, Rob. How's it going today?
Very good today, Paul. Thank you.
Good.
Your experience, please.
No, I've got some experiences. So, but I would like to just touch on the last caller, what she was talking about getting a doctor. I've had 3 doctors in some 40 years here in Red Deer, and each time I got the doctor, I went to a walk-in clinic, and every time I went there, I just kept asking for the same doctor. That's how they became my doctor. And most people don't want to wait, and there's been times where I've had to wait. Like if I make an appointment with my doctor, I'll wait sometimes 2 weeks, maybe 3 weeks. But if I go on a walk-in day, I usually get in to see him. Like if I know that he's there on a walk-in day, I go there. I have to stand outside sometimes in cold weather, rainy weather, whatever. If I stand out there and I'm one of the first, 10 or 15, whatever they're taking that day, I get in. Otherwise, I wait that 2 or 3 weeks to see my doctor. But my experience with the healthcare system, I work for them. And
you work for them. Okay.
Well, I'm a volunteer. I'm a volunteer at the hospital.
Volunteer. Okay.
They call us like
good for you.
Yeah, they call us like one of the crowd, But the thing is I've had to wait too for operations and different things. But our 811 line that we have here in Canada, I believe it's all across Canada. I've phoned it 3 times, and the first 2 times, the first thing that came out of their mouth was go to the hospital, and I never went either time. And I'm still here to talk to you. The third time I called, it was a vitamin that I had taken, and it really messed with my system. And I'm thankful that they were there, but I had a hard time getting through that third time. And when I did get through, they told me that the symptoms would subside. And that was the only time that they helped me. The other 2 times, they told me, go to the hospital, go to the hospital, go to emerge, go to emerge. Well, to me, that's not what I think 811 was designed for originally. I think it was designed to, talk to people just like they did the third time. They helped me with, I told them what vitamin I had taken and how it's messing with me. And they told me, this is what will happen. It didn't happen the way they said. They said a couple hours. It was more like 6 hours, but it did subside. So I think if that was improved with, talking to people, I think that would help a lot with, people not going to emerge. And then with the family doctor thing, I just think that people need to, when they do go to these walk-in clinics, just focus on one doctor and then just keep going in and wanting to see that doctor. That's how I got, my 3 doctors over the years. And then lastly, in emergency, what I've seen every time I've ever been in emergency, and you've heard this probably several times today, that there's a lot of folks there that they don't need to be there. And when they get up and leave, they didn't go off and die, but they got up and left because they realized, I'm not going to be
maybe
seen.
I don't have to be here. Yeah. Okay.
That's right.
Yeah, fair enough. But I think you make a good point. Like 811 in Ontario, it's called telehealth. It's not 811. It's called telehealth. It's a different number, but maybe we should make more use of that or advertise it more, public awareness or something like that. Maybe that's not a bad idea that you have there.
Yeah, And then lastly, just that they have people that are properly qualified to, deal with the situation and not just send people to emergency.
Yeah. Very good. Thank you. That's Paul in Red Deer. Some practical advice for people trying to find a family doctor and what it's like to use telehealth. That's what they call it in Ontario, or 811. What about you? What are your experience, the good, the bad of Canadian healthcare today? On Talkback, hour number 2. This is News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
On healthcare, the state of the healthcare system where you are, and the good and the bad. Rick is in Dartmouth, Nova Scotia. Hello, Rick.
Hi, Rob. I'd just like to start with a generality. In any system that is, designed to contain a certain number of units of whatever it is that they do, that would include the healthcare system. Increasing the number of units that are entering the system is bound to make problems. And you can look no further than the immigration numbers over the last 10 years. How could our system, even though it keeps trying to grow, it's not an easy thing to grow, as many of your callers and you have already stated. So if you are confused about why it's in such a crazy state right now, there's your answer. 6 million people, as you mentioned, in going in and coming out of ERs without being treated is crazy. But
1.2 million. Yeah, 1.2 million. I would just say, you say immigration is the answer. I think it may be part of the answer. I don't think it's the only reason why healthcare is in the state that it's in. People, the population is aging. It is an element. I will not deny that. But the population is growing older. You have doctors who are retiring. There are all sorts of other factors, right? So yeah.
There are for sure.
Yeah.
But to me, that is the most evident. Now, that's notwithstanding, I'd like to say that I have very good health care here in Nova Scotia. Okay, we have an 811 service that I use, quite frequently. Now, this may be a record for any of your callers. I've had the same family doctor for 47 years. Okay, let that sink in for a second. I thanked him many times for not retiring. Anyway, I get I get pretty good care from him regarding that puts me in the lower 70s age group. But I had a funny call. I called 911. I just to lighten up a little bit. I called 911 earlier this week just for a minor problem, just to check it out. Say, look, is this can this be serious? And they're all registered nurses here in Nova Scotia. But they have a list of questions. 811, they have a list of questions that they have to ask you, and I know this from experience. But she got me this time when she asked me, is there any chance that you're pregnant?
Maybe they have to ask you that now. I don't know. Times they are changing. Anyway, okay, Rick.
Yeah,
all right,
well,
thank you.
Okay.
Very good. Bye-bye. Sharon in Calgary. Hi, Sharon.
Hi. I wanted to tell you that I believe that the healthcare is doing a great job.
Okay.
Not all the time, but most of the time. Last year, I had 6 doctors. This year, I only have 3 because I'm getting better.
Okay.
But they have an unreasonable workload. And with that unreasonable workload is a number of people that are going to the doctor because they have nothing better to do. And
nothing
so
better to do. What do you mean nothing better to do? What do you mean by that?
They don't have anything else in their life to do, so they go to the doctor and think of some fictitious problem and then demand an MRI. And then people complain bitterly that they've had to wait a year to get an MRI. My premise is they didn't need one in the first place. If they really needed an MRI, they would have gotten one, as I did, in a matter of weeks. I didn't. The worse you are, you go to the front of the line. That's the way it goes. And I have gone to the Foothills Hospital, not recently, but probably 5 years ago for emergency. Checked in at the desk. 3 minutes later, a doctor saw me.
Wow.
So the whole thing is, if you have an emergency, they are there for you. And so now family doctors, another story totally. I had a hard time finding a family doctor, and it goes back to supply and demand. If you want to have more family doctors that are devoting at least 10 years of their life to becoming one, you need to pay them accordingly.
Okay.
Family doctors are underpaid, and my daughter...
And you think they're overworked, right? And overworked?
Definitely.
Okay.
Yep.
All right. But generally speaking, you have very positive reviews of the healthcare system where you are in Alberta. Thank you for your call today. Sharon calling from Calgary. Be right back with more of your calls and more of your experiences, the good and the bad of healthcare, today on Talkback on News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
What's your experience, good or bad, with the healthcare system? Greg in Calgary up next. Hi, Greg.
Good day. Good day, Rob.
Yeah.
Thanks for the episode. Thanks for the topic. Thanks for the comments from many people. It's a complex problem. There's many factors, as you pointed out. Immigration's one, an aging population. An underlying problem we haven't talked about is people not taking responsibility for their health care. And that gets to prevention. The one caller mentioned spending more money, paying doctors more. Alberta is the poster child for two things: throwing money at a problem without a lot of success, but also a poster child for innovation in healthcare. They are 888 number. I've been sent to emergency for good reason on a couple of calls, and I've been kept from the hospital. And the triage, it's really hard to assess a patient without seeing them physically and just relying on their subjective symptoms as they understand them. So it's a difficult job. But being kept out of the emergency room, they've done that successfully 60 to 70% of the time I've called. So that's a good thing, because the emergency rooms are overwhelmed across the country. If we look at innovation, there's something we developed here. I would note, it's my understanding Saskatchewan's been a leader at healthcare improvement in terms of hospital efficiencies, so running hospitals better. Alberta tries to do that, but they've done something even better, which is called a primary care network. And we have 75 roughly primary care networks in the province of Alberta. And each of those are defined by geography. They don't compete with one another, but they ask physicians within a geographic area to join them. And if a physician chooses to move his or her panel of patients to a primary care network, that organization, the PCN, gets a per head or per capita payment of, I think it's around $75 a year. And with that money, they deploy 14 plus flavors of allied health professionals, from RNs to LPNs to physiotherapists to addictions counselors, to address the needs of their panel of patients. And the PCN can look at all the doctors within its geography and say, where do we best locate those healthcare professionals? Some might be located in a doctor's office, In some cases, some might be down at the mall or downtown in an office building, but it's just a very efficient way to get the doctor's job offloaded to being 100% what they're paid to do, what they're trained to do, is to diagnose and prescribe, and leave it to these other people to treat, rather than trying to be the addictions counselor and the mental health counselor and the social needs counselor.
Yeah,
and of course, a good caring doctor would spend a long, long time providing those services, but guess what? The waiting room fills up.
Yeah.
So that's one dimension, and I would recommend everybody in Canada, and maybe you yourself with your researchers, there's a group here in Calgary called the Crowfoot Village Family Practice, and they've taken that even a notch higher.
Crowfoot?
Crowfoot, one word.
Yeah.
Village Family Practice. And they've taken that PCN model that's been around for about 15 to 20 years to even a higher level, where they've got a half a dozen physicians co-located in the same office. They've got all of their administrative staff, from the receptionists to the nurses to the records keepers. Tremendously efficient operation, and they're able to increase their panel of patients per doctor dramatically. They're able to improve their quality and access to service better. They do it for less money per patient per outcome, and they're the most studied personal care setting in Canada right now. They've shown that they can save the system $10 million a year and provide better outcomes.
One practice. Wow, isn't that something? Okay, that's very interesting. I'm going to look into that. Thank you. I don't have a team of researchers. I'm the team. 1-833-668-2577. The latest breaking news is coming up next. This is News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow,
where we have been talking about healthcare today. Gathering your experiences with the healthcare system, wait times, ER visits, family doctor searches, even paying for private healthcare. Donna in Calgary up next. Hi, Donna.
Oh, hi. Thank you for taking my call.
You're welcome.
Just a couple of points here. I've had to use the ER twice, both times with my daughter. One anaphylactic shock. We walk into the doors. I didn't even get a sentence out, and they had me in the back. The second time she went in, she had a concussion and then side effects, seizures, collapsed lungs. And again, trauma unit, ICU, like the whole setup at the Foothills Hospital. The staff there are phenomenal. On the other hand, we have lived overseas for 15 years. We lived in Australia and the Netherlands. They both, public and private. Australia is probably the country that's probably the most closely related to Canada in regards to social systems and such. It works well over there. We have the choice between public and private. The staff over there, they have to work in the public system, they have to work, and then they can work in the private system. It worked well over there. Fabulous. I would say the only problem with the Australian system is, and this is Western Australia in Perth, the country doesn't seem to be able to produce enough doctors or nurses. Every single person that I've come in contact with in the hospital when I had to overnight there, not one person was Australian. None of the nurses, none of the doctors. Wow. But I'm just not, now that we've moved back to Canada, I'm not sure why people are afraid of a both public and private healthcare system.
Well, I think it goes to the Canadian identity question that I talked about before, that it's so ingrained in the Canadian culture, universal, publicly funded healthcare.
That's the problem. But if this was a quote unquote and I know you cannot compare business and corporations, but if this was a business or corporation, this would have been changed decades ago because of all the money that is just being lost and abused.
Okay.
It's just not working. Like I've struggled here in Calgary to find a doctor, and the previous gentleman that was talking about the Crowfoot Clinic.
Yes.
Yeah, they've got a huge wait list.
They do. Okay.
Yeah. So it's just we're really struggling here with the whole system since we've come back. I just don't know. Yeah, I just don't know why Canadians are just so afraid of a little bit of change.
Okay.
It can be gradual, and a previous.
Well, I would say change is coming. Change is happening already. I mean, private healthcare and Canadians embracing private health, it's proliferating now.
I know, and it's fabulous. And an hour ago, a gentleman had said, "Well, we've got these CT machines and the MRI machines. Why can't we just go in and use them 24/7?"
Oh, I think we lost you. I think we just lost her. Let's move along then. Great points, though, Donna. Very, very interesting. John in Calgary. Hi, John.
Hey, Rob.
Hi, John. Yeah, I hear you just fine, John. Go ahead, please.
I'm going to switch you onto my... There, that should be better.
Yeah, sounds good.
Okay, yeah, long-time caller, or long-time listener, first-time caller, rather.
Appreciate that. Thank you.
An observation that I have in regards to some friends of mine who are immigrants to Canada is that they come extremely qualified, and they did their master's level, PhD stuff, typically in the UK, and then they come to Canada and they have to recertify everything before they're allowed to work in healthcare. And I just feel like we have probably a lot of people in the population that are working jobs that they're overqualified for, and if we made the regulatory process easier, it might relieve some of the pressures on healthcare.
Oh yeah, it's not just that. It's it's the whole labor mobility issue. I mean, you maybe you can get approved to work in, say, where you are in Alberta, but what if you want to move to Saskatchewan or British Columbia? You've got to do the whole process all over again.
Exactly. Like the friends I'm thinking of, they're from Nigeria originally, but for the most part, like they all went to school in the UK. And the fact that Canada and the UK are both Commonwealth countries, you think there would be more transatlantic capacity to qualifications over, right? Like it doesn't make sense to me.
Okay.
Anyways, that's all I had to say.
No, it's a good point. It's been brought up several times during Talkback today, John. Thank you for listening, and thank you for calling. We will stop here and be right back with more of your calls. Busy one today, talking about healthcare. Always a popular topic. Everybody has an opinion on the healthcare system, what's good about it and what's not so good about it. What's yours? Be right back. This is News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
Yeah, we've been talking about healthcare today. Been very busy. 3 or 4 lines there. 1-833-668-2577. Your experiences, good and bad, with the healthcare system where you live. Wait times, ER visits. Family doctor searches. We'll talk about it. We'll talk about it all today. Paul in Kitchener. Hi, Paul.
Hello?
Hi, Paul.
Sorry, Mike, I have to turn on the radio. Just 1 second. Okay, I turned on the radio. I'm probably a little bit younger than most of your callers. I'm going to keep it short and sweet. My problem isn't with the healthcare system specifically. It's with Canada's laws against inbreeding. And the problem is a lot of people, I'm not without the sound of sounding racist or anything like that, but a lot of countries that are coming here and migrating, and my parents are immigrants, but my problem is that a lot of these countries come here and they're married to first cousins, and they're producing children that are putting a strain on our healthcare system. And that's my problem. And I just want to keep it short and straight. And that's all I wanted to say.
Okay. All right. All right. Fair enough. Okay. Okay. Thank you. Thank you, Paul. All right. You get all kinds. 1-833-668-2577. 1-833-668-2577. The ER wait time report from the Montreal Economic Institute. I know that made news a few days ago. I was surprised how a lot of news organizations picked up on that. Maxime Bernier used to be a big executive at the Montreal Economic Institute. Very, very free market kind of libertarian think tank in Montreal. But nevertheless, a very, very, very troubling report about the number of people who go to the ER, but they leave before they ever get treated. It's an assumption for sure that most of those people, if not all of them, are leaving because of how long it takes to see someone and get treated. We've all had some experiences with that, wait times in the ER. You know, if you end up in the ER, it's like, don't make any other plans that day. But, I mean, there could be all kinds of other reasons why people would leave the ER. As some callers have mentioned, maybe they feel better. Maybe they decided they didn't need to see a doctor after all. Maybe they drove there. They couldn't afford the parking. Hospital parking. I mean, it can be expensive. There could be other reasons why people go to the ER and leave, other than the long wait. But it's hard not to conclude that most of the time it's likely they get fed up and they leave. And as the report notes, it's not a good thing, because when that happens, in some cases, those people end up back in the hospital in worse condition than they were the first time around. And the report says sometimes the condition has deteriorated to such an extent they need to be admitted to the hospital. It's just taking something bad and making it worse. It's a report that it kind of hits home for me, because I've had some experience with an older relative of mine who wasn't feeling well. Family doctor wasn't available. They would usually go to the family doctor. No choice but to go to the ER. And after sitting there 7 or 8 hours, got up and left. And you know what happened? A few days later, they were in the hospital. So I can kind of relate to that one. The figure in the report from the Montreal Economic Institute, 1.2 million Canadians went to an ER and left without ever being seen by anyone. 1 in every 13 visits to the ER, the person doesn't wait around to get treated. Varies across the country. It's about the national average, about 7% of visits to the ER, the patient leaves before they're ever treated. In Ontario, it's lower. It's about 5%. In Alberta, it's higher. It's closer to 9%, closer to 10% in Nova Scotia. Worst performing provinces, PEI in New Brunswick, 13 and 14%. It's terrible in Quebec as well, where I am. The worst of the large provinces by far, 11.5%. I can kind of attest to that. A few years ago, I ended up in the ER. I was there all day. And eventually I needed to get a scan, and I'll never forget, they wheeled me into the elevator to take me up to where they do this diagnostic scan. And the halls of this entire floor of the hospital were just lined with people. People on stretchers, people on cots. I mean, it seemed like it must have been 100 people. This is like a small town Quebec hospital. And honestly, it reminded me of a scene out of a movie. Like there's been a natural disaster or a catastrophe and the hospital is flooded with people. But nope, just a regular weekday. I was told nothing out of the ordinary. And I told my wife, the next time I come to this hospital, it'll have to be because I'm near death. And we'll just have to learn to become medics or something. Unreal experience. Unreal. Thank goodness I haven't needed to go to the hospital since then. Knock on wood. Knock on wood. But have you had an experience like that? Several callers have had completely the opposite experience and have nothing but praise for the healthcare system. Just curious as to your experiences. 1-833-668-2577 in the home stretch here of Talkback. I'm Rob Snow. This is News Radio.
Have something on your mind you want everyone to know?
Call now.
Hello.
1-833-668-2577.
It's Talkback on Now You Know with Rob Snow.
Yeah, we've been talking about healthcare today and your experiences, good and bad, with the healthcare system. Justin up next. Hi, Justin.
Hi there, Rob. Nice to hear your voice again on my phone.
Well, thank you for calling, Justin. What would you say about today's topic?
Well, first of all, I'm sorry for the experience you had. That's awful to see. It really shakes a person to see people in pain lying in a hallway like that. It's tough. It's tough to watch. I'm sorry you had to see that. I've had to go to the ER a few times over the years, and I've had good and bad. Here in Alberta, it's about $450 to check yourself into an ER triage. All the paperwork, everyone involved, and people look around the room and they think, geez, maybe I really don't need to be here. And I think that I'd like to give the benefit of the doubt to some of these people who are like, maybe I don't need to be here, and they get up and they leave. But for those who really do need to be there and feel like I can't take the agony anymore, I have to see someone, I'm feeling ignored. I mean, it eats you up inside. And my experience has been, I have been in hallways, I have been in rooms, I've had my own room, I have had, and I've had just simply had to sit in a chair for 2-3 days. The doctors have been
2 or 3
great.
days.
The nurses have been excellent. Excellent.
Okay.
I don't think it's a nursing shortage. I think it's here in Calgary. I think it's more of a doctor shortage. And the lack of ability for these doctors to give nurses power to assess and treat people. I just don't think you need that big of a degree in medicine to see that somebody has jaundice. Their eyes are yellow, they're hurting. You know what I mean? But there's other things when people come in with chest pain and they really do need a doctor. And for those people with a little bit of a cough and, they feel that they're suffering, but when they get in there, they realize, geez, maybe I don't need to be here. And I think a lot of the people, at least here in Calgary, are walking out of there because they feel guilty for being there. What do you think about that, Rob?
Well, as I said, there could be any number of reasons why people do walk out of ERs. Everything from the cost of parking to, as you say, you know what? Do I really need to be here? Do I really need to spend the next hour, 9 hours of my life here? It's interesting that what you're saying about, can we share the load a little bit? This federal government study said we had 23,000 family doctors short in the country. Can we make more use of nurse practitioners and practical nurses and registered nurses and,
I'm glad you brought that. Exactly. RNs especially. I mean, these are highly trained nurses. These people know a lot of medicine, a lot. And they can really help with diagnosing things. The triage nurse can only do so much. And there's usually only one per ER, at least here. And so you come in, you see the triage nurse, and you get sat down. And then you can't help but feel, boy, am I sitting in a place full of people that can make me even feeling worse than I feel? Maybe that's another reason, right?
Yeah, and nurse practitioners, nurse practitioners are already RNs, but they even have more training than RNs. Right?
Yeah,
so
okay. Good call. Yeah.
Anyway, okay.
Hey,
well, look, thank you. Well, I love your call. Thank you. I don't know if my mother told you to call, but thank you very much. Okay, that's it for us today. We'll be back tomorrow. Brand new topic and more of your calls. And it's a very busy news day around here. So we'll bring you the very latest breaking news right now, coming up on News Radio.
Corporate megastores are spending millions lobbying D.C. politicians on one-sided policies that send small businesses tumbling. They want to enact harmful credit card mandates that take resources away from your local credit union and community bank, leaving Main Street businesses with less access to credit, making it harder for your family to pay for everyday goods like gas and groceries. Tell Congress to guard your card and oppose the Durbin-Marshall credit card mandates.
Paid for by Electronic Payments Coalition.